Federal Health Minister has poured cold water over claims changes to the PBS will cause medicine shortages. The reforms will enable millions of Australians to access a 60-day script instead of just 30 days. Live to Georgia Simpson in Melbourne, Georgia. The concerns over supply shortages, who's raising these?
Tom, these concerns are coming from the Pharmacy Guild of Australia. President Trent Twomey says at the moment there are major issues with supplies for some medicines and that these reforms will only make that worse. He said some pharmacists don't actually have enough stock at the moment to fill a 60-day script.
How do we give somebody 60 days instead of 30 when we can't get 30 in stock now? So it's a little bit of smoke and mirrors. We feel like it's a bit of a kick in the guts. So how do we give people extra when we can't even give people the minimum amount that they need?
These claims were disputed by the Federal Health Minister, Mark Butler.
This is not going to change the number of tablets dispensed in a given period of time. It's simply going to mean that people can get 2 boxes at a time instead of having to get 1 box and come back twice as often. We have very strong arrangements for supply from wholesalers in this country.
The federal government says that these reforms will save around 6 million Australians up to $180 every year. They are aimed or targeted rather at Australians with chronic illnesses. They'll be able to get 2 scripts for the price of 1. These changes will begin to come into effect from September and cover over 300 medicines. It's something that the Australian Medical Association supports. They believe it could free up appointments with GPs. We know it's hard at the moment to get an appointment with a GP in Australia. These changes will also bring Australia in line with other countries like the United Kingdom, New Zealand and Canada. The full cost of these policy changes, Tom, will be revealed in next month's budget.